I don't know if any of you have noticed, but we have a new surgeon in the office. And today you're going to get to meet her and learn a little bit more about what she does. So welcome to another episode of the Trillium Show. I'm Dr. Jason Hall, board certified plastic surgeon and author of the new book, Art of Aging, which I conveniently forgot to have sitting next to me. But the link is in the bio down below, so you can go check that out. And today I have the distinct honor to have Dr. Jessica Walker here with us so you can learn a little bit more about her and what she does. Dr. Walker is a dual board certified plastic surgeon. So we'll talk about what that is here in just a second. She did her general surgery training in Detroit, which is a lot of general surgery training, and then went to University of Louisville for plastic surgery. And did additional plastic surgery training after that. So she has done a lot of training. And so without further ado, Dr. Walker, welcome to the show.
Hi, thank you guys for having me. I'm excited. This is my first show ever. You guys know me. I do a lot of social media, so short clips. So this is going to be my first longer show, and I'm not going to lie, I'm a little bit nervous.
So long form podcasts are awesome. They're so much better than just the 30-second little clips. But I heard you telling a story the other day that you actually weren't planning on being a doctor, but your mom knew it from like when you were a little bitty. Tell me about that.
Yes. So ever since I was little, my best subject in school was always math. I loved math. I don't think I would love math now. It's changed. It's different, but I loved math. It was my best subject. Science was also great, and I enjoyed that as well. But going into college, I kind of went in undecided, anticipating either doing something with math or science. But I decided after my freshman year, when I was home for summer break, my dad set me up to shadow a general surgeon when I was home down in Eastern Ohio. And the first day I was with this surgeon, Dr. Cross, he let me scrub into surgery to observe, and it was a bowel resection. And it was amazing to just see him take care and fix a human with his hands. And I thought that was incredible. So that's what made me decide to want to be a doctor. But my mom will always tell you that she knew since I was 7 years old that I was going to be a doctor. When I was 7, my older sister was in high school, didn't have her license yet. So we were on our way to her volleyball game to watch the game, obviously, and then to bring her home. My mom stepped on our dog's ball and rolled her ankle. So my dad had to go because he had to pick up my sister and took my little sister with him. And I actually ended up staying home with my mom. And I was like icing and elevating her foot and taking care of her. And she knew from that moment that I was going to be a doctor, whereas I didn't know for many years later. So that's her story.
The funny thing is that when I heard you telling this from across the room, I thought that your mom stepped on the dog's balls and that you were icing the dog's balls. So I totally missed that story. So
a little bit different.
Yeah, a little different. But still, the point is the same, that you were
that I stayed home and took care of my mother instead of going down to watch sports and things.
Yeah.
So
I trained in Dallas, knife and gun club. Mm-hmm. What was general surgery training in Detroit like?
So Detroit everyone knows Detroit's reputation, and it's the same. It's knife and gun club. There is not a shortage of that every single night, level 1 traumas. So I definitely am very well-versed in trauma training, and I still feel well-versed in that when I hear about things, and I can kind of predict what's going to happen just because I did that. And I was an instructor for ATLS, which is our trauma life support that we teach. So I did get a ton of trauma. And I was in a hospital that was in East Detroit. It's now Henry Ford St. John, but it was Ascension St. John when I was there. And you're getting everything. And we were a level 1 trauma center. We did pediatrics, we did adult. So lots of trauma, but I felt very well-rounded that had I left the program and not done extra training, I absolutely could have been a general surgeon with my eyes closed. I mean, and you don't hear that often. I feel like most surgeons nowadays do extra training. But I fell in love with plastics in my 3rd year, and I knew that was my calling. So I chose to do that, and I matched at my number 1 choice, which was Louisville. And that's actually where I met my husband. And I tried to convince him to go back to Detroit. I would have went back to Detroit in a heartbeat. I loved Detroit, and I love the surrounding areas and just the state of Michigan and as a whole. It's a beautiful state to live in. But Knoxville is where he's from, and that's kind of where we decided to move back to because I fell in love with the mountains and just the area once I came to visit. So, but Detroit was wonderful.
We all follow your Instagram account, which is awesome, by the way. If you don't follow her, you need to follow her. We'll put her link in the bio down below. But you seem to have with all the orange and white and the Tennessee Vols, you seem to have integrated pretty well, especially during football season.
Yes. So my husband and my brother-in-law both went to UT, so the whole family are all, lots of aunts and uncles and things like that, my in-laws. I was born and raised on Notre Dame, so I am also a Notre Dame fan on the side there. They're having we'll just call it a questionable season right now, but I just love college football as a whole. I also watch professional football, but I tend to lean towards college as well. But as you and I both are, we are both another sad team right now are the Steelers, but they're winning. As I walk in this room, they're still winning.
They're winning. They don't have an offensive line. They don't have a defensive line, but they're still winning. So we'll let Aaron Rodgers ride off into the sunset with the Steelers.
Hopefully that's what he chooses to do and not keep going. But no, my Steelers in my brain is Jerome Bettis, the last Super Bowl, which was in Detroit. That's what my terrible towel is that Super Bowl era. And that's my always thought of the Steelers as that team. So,
yeah, I have a picture on my wall of that game. We were at that game because my dad grew up in Pittsburgh. Nobody watching this actually really cares about. You're not watching this for football, but the Steelers have been a lifelong passion. My dad grew up there, and so everything has been black and gold. So. Yes. It's good to have another Steelers fan in the office too. Now my wife doesn't have to listen to it. I can talk to her about it.
Exactly.
So shifting gears a little bit, one of the things that we started talking initially about was kind of breast and body contouring. That seems to be something that your results are certainly fantastic, and something that you really enjoy. And specifically with abdominoplasty surgery, what is it about that kind of drew you to it? Why do you like it?
So it's a little bit hard to describe. I just, I enjoy doing face and I can do face, blephs, facelifts, things like that. But as I was doing the surgeries, I'm like, I just don't enjoy this as much as I do like doing breast and body contouring. And I don't know if it's now being a mom and having had a C-section. I'm breastfeeding right now. So my changes in my body is what 90% of my patients are going through and telling me about. So I feel that I understand them and can help get them back to that body pre-baby. Because your body, it's amazing what the body does and what it goes through. And now that I've seen that, it just makes me want to help them regain that confidence that they used to have and bring them back to that pre-baby. So I think it's kind of a combination of what I like to say is macro surgery. I like big surgery. The face is very tiny movements, tiny surgery. I like macro, seeing big results. And then now that I can relate to my patients on that level, I feel like I'm helping them. And that's what I like to do. They're very thankful and they're very realistic in their goals.
And you were very public about your challenges conceiving and with your whole pregnancy journey is out there on social media. How has becoming a mom kind of changed your perspective with surgery? So with plastic surgery itself?
So yes, I wasn't open as I was going through it, but there was a time where I was like, I need to tell my patients because I had to cancel things. We got pregnant initially in the fall of 2022. I told my husband I was pregnant the day after Christmas, and the day after that, I had a ruptured ectopic, so it was an ectopic pregnancy. And then I subsequently got pregnant after that and miscarried, and then got pregnant again, miscarried, and at the same time, my husband was actually diagnosed with kidney cancer. So it was all just a lot going on. And then we met our fertility doctor. My husband is now in remission. He is doing phenomenal. We met our fertility doctor. I did end up having to do IVF, and it was basically because I'm older. And there's actually studies that do show that female surgeons, specifically female plastic surgeons, have higher rates of infertility. So I kind of anticipated it. But now our first embryo transfer turned into our perfect, going through a 4-month sleep regression right now, perfect baby boy, and I love him. Motherhood, going into it, I was like gung-ho, surgery, career, and as soon as I saw that baby the first time after surgery, I completely understood why people want to be stay-at-home moms. Like that, he is the love of my life outside of my husband and my German Shepherd, and I would do anything for that baby. So I feel like I understand a lot now. It's changed my whole perspective and outlook on life and career. I mean, I love my job, but it's nice to get done early one day so I can go pick him up early and hang out with him and do those things. So whereas before I was like, all right, let's work, let's do this 6 a.m. to 8 p.m., let's keep going. And now I'm kind of finding that work-life balance. So it's been great.
That's something that medical training, certainly surgical training, doesn't prepare you for, is getting married, having kids, and having to integrate those two very different worlds. Because you're right, it's the just like any job. I mean, I think friends that do investment banking and that do sale, that are in sales and running big sales teams, the work is always there. There is always an opportunity at 9 o'clock at night to be working or to stay in the office until 9 o'clock at night. But I think having a family, being married, having children especially, kind of puts somewhat of a balance on, when you want to be home. Now,
Yes.
The problem with us is that medicine's not exactly a 9. You can't just like turn it off and, pick it up back the next morning. Something happens, we got to be there.
Right.
And that's why it's nice having multiple people in the same group to be able to kind of watch, tend the shop.
Especially in surgery, the acuity of our patients, we're doing procedures on them. So if something goes wrong, somebody needs to be available. So I feel like even though our hours, to say simply, are better in a work-life balance, I feel like I'm still on 24/7 for my patients. I answer them when they message me through social media, or if they call the office, we're always calling them back. We have to be on that 24/7. But it's definitely, I've learned kind of like what you explained, that unless it's obviously an emergency, like things in life, they'll happen eventually. You got to slow down, be where you're at that time, and not stress over things that don't need to be stressed about.
And you've reached this so much that is so much earlier in your career than I did. So congratulations
Thank
for
you.
that. Let's talk a little bit about procedures. Specifically, we kind of alluded to it earlier, specifically abdominoplasties, because you and I do things a little differently. And kind of talk to me a little bit about the ideal tummy tuck candidate.
Okay. Ideal tummy tuck candidate, what we do is elective surgery. So we really want to optimize the health of our patients. There's nothing that we do that has to be done. And I would never tell a patient they need to change something about themselves. I think everyone's beautiful. If you want me to help you, I'm here to help you. So the ideal tummy tuck patient, really we like BMI is kind of it's a tough number to use because, muscle weighs more than fat, and sometimes that can play into it. And it's really based on physical exam, but we do like the BMI usually to be less than 30 because studies have shown that there's more complications over that. Somebody who is taking care of themselves. You don't want to go in and do this big surgery and then they go and do the opposite thing and gain weight or do things afterwards that's going to counteract what we're doing. The other thing, too, is you really want to be done having kids. If you're planning to have children and you want to have this type of surgery, you really want to be done having children because we do a muscle repair after this. And that is what we call a diastasis, so the separation of the muscles from having babies. So you really want to make sure you've honed in, you're where you're at, health, diet, exercise wise, but also based on your medical history that you're safe to have elective surgery. So those are kind of the key things we talk about with our patients is their health history, their surgical history, and what their goals are and where they're at in their life if they're ready to have this surgery done.
What is the big deal with the muscle repair? Why are we waiting on that, on people to get done having children before doing a muscle repair?
Yeah. So for me, I think it's less so the muscle, more so the fascia, which is the fibrous covering of the muscles. So when you get pregnant, your uterus enlarges and it stretches out those muscles in that fascia. Unfortunately, the fascia is not elastic. It doesn't bounce back. So when your uterus goes back to normal size after you're done having children, the fascia does not snap back. You're never going to have that pre-baby body like you used to, no matter how hard you try at the gym. The muscles usually have laxity to them, and that's what we call a diastasis, mainly of the linea alba, which is the fancy term for the fascia that's right in the midline. So when we go in there and we raise the fat and muscle, or excuse me, we raise the skin and fat off of your muscle, we can see the looseness. We can literally tap on your belly and you see how loose it is. And then we go there and we tighten up kind of a football shape that closes into a straight line. And then you tap on that belly and we say bounce a quarter off of it. It's nice and tight. And that's what we like to do. That's why I want to make sure you're done having children, because that can get re-stretched if you have kids after having a tummy tuck. So that's the big thing. In my opinion, that's the biggest part of a tummy tuck, is fixing that muscle laxity.
How difficult is it if somebody thinks they're done having kids and then has an abdominoplasty and then has an oops baby? How difficult is it to fix that again if it stretches back out?
So it just depends. Some people actually, after they've had their muscles fixed, do actually go back pretty tight if they have an oops baby. Other things, though, that can play into it is, did the skin stretch as much? Do we have enough skin to take out again and redoing a whole tummy tuck, or do we just need to go back in and fix the muscles? So it all really depends on timing. We usually don't recommend doing a tummy tuck until you're a year out from having kids, so the body can bounce back as much as we possibly can get it to. And the scar tissue, what you've built up, how far it's been from your last tummy tuck. So it's definitely a little harder than a fresh tummy tuck, but it can be done.
Sounds like there's a lot of variables, a lot of ifs, a lot of ifs in the redo. So just if there's a lot of ifs, if you hear your surgeon saying there's a lot of ifs and a lot of variables, then it's probably redos. We want to avoid those as much as possible. Mm-hmm. Absolutely.
Yes.
So when you're doing an abdominoplasty, you're lifting up all that skin to be able to see the muscles, you create a lot of empty space. Mm-hmm. And that's typically, and I've been doing this for a while, that's where the drain goes. And that's why, the tummy tuck is that one procedure where, even though most of them we don't use drains anymore, I still use a drain. You don't.
I don't.
Talk to me about that.
Drainless surgery.
Talk to me about that.
Yes. So, and that's a big thing. I think it's definitely up and coming. There's definitely still surgeons who use drains. I don't think it's unreasonable. But in my hands, so when we do a tummy tuck, like I mentioned before, we raise the skin and the fat as one unit off the muscle. So we're cutting all those attachments. So what he mentioned is we're creating what we call dead space, or when we lay the fat back down on top of the muscle, we're not recreating those attachments. So there's space for fluid to fill. So traditionally, we usually leave 2 drains. I believe you only leave 1 drain now. We used to leave 2 drains, and we would take those out. We would take those out usually 3 to 4 weeks after, it has to be below a certain amount coming out before we take those out. But what I do in surgery is I recreate those attachments. I do something called progressive tension sutures. So as I'm laying the skin and fat back down on the muscle, I'm placing sutures to reattach it back down so there's no space for fluid to fill. So in my hands, from what I have seen, I did with drains during residency and fellowship, without drains now as an attending. You can still get a seroma, which is what we're trying to prevent, is that fluid buildup in that space after either of these procedures. But what I have noticed is I see less postoperative seromas doing the progressive tension suture technique in my hands. And the other thing too is patients hate drains, and I hate drains. So that way we can avoid that excess having to have a drain after surgery. Now, there's definitely times where I do leave drains. I have left drains in tummy tucks when you go in and there's a little bit of a surprise that you weren't anticipating. You can't place those progressive tension sutures. You definitely still have to leave a drain. But that's kind of the technique that I have worked on, and that's what I've been doing now for over 3 years.
Does not leaving a drain depend on how much skin you're removing, how long an incision you have to leave, how much liposuction is there something that kind of goes into that decision, or is it everybody?
I would say it's not everybody, but it's the majority of patients for me. I would say the times where I would potentially leave a drain is obviously if I find something that I was not anticipating. And then I would say with high volume liposuction, because to do liposuction, we actually put fluid in to take fluid out. And high volume liposuction does create more swelling. So if you can predict the amount, if it's going to have a lot of swelling, then I do still think there's a role for a drain to help keep the swelling down, because that's going to put tension on your incisions. So there is still a role for a drain. I would say for me, when it's skin work, like the tummy tuck or a body lift, I don't lean towards drains. I lean towards drains if there's a surprise or if I'm doing high volume liposuction with the procedure.
Okay, so even with body lifts, so like the tummy tuck that goes all the way around, you're not putting drains in those?
No, I don't. I just make sure that you really close down that space that you've created so there's no space for fluid to fill. So
I bet people love that.
they do.
That's awesome.
And my nurses love it too, because they don't have to help me with drains in the office and all those things. So
Yeah.
it's great.
Oh yeah, our office staff really enjoy not having
drains.
not having to deal with drains and coach people through the process of getting rid of those things.
Yeah. But when I talk to my patients, I tell them I do drainless, but I always say if there's something abnormal or I find something I wasn't anticipating, I will leave a drain. I will always do what's safest for you. And if leaving a drain is safer, I will do that. But majority of the time, no.
You mentioned finding a surprise. What's an example of a surprise that would make you want to leave a drain?
Large hernias, if there was a hernia that we weren't anticipating, that hernias pop out like a little balloon, but sometimes they go back in if we can't feel it on that initial exam. Sometimes if you find a large hernia, that would again, or if I do high volume liposuction, the one patient that I did have to leave drain on, she had kind of almost an incomplete hernia. A hernia by definition is a defect in the abdominal wall, and she had her from previous lower abdominal surgeries like hysterectomy, C-section, her anterior, there's layers of the abdominal wall. The anterior layer was intact, but I could see everything below that. The muscle behind it wasn't intact. So I did not feel comfortable, because with progressive tension sutures, you're placing stitches with needles. I did not feel comfortable doing that for her, so drains it was. And we actually ended up not fixing her muscles either, but she ended up still having a great result. So I would say being a general surgeon first has absolutely helped me in doing abdominal surgery, because I have been inside the abdomen and I know how to treat things inside the abdomen or what to predict for things. So I definitely think that has helped me in doing drain and drainless surgery.
Yeah, I think the general surgery training is very important to have that. First of all, to have the experience before getting into plastic surgery, that you've had that experience really taking care of sick people, we're doing big operations, and knowing what could go wrong.
Well, that, and I think for us too, we operate on a lot of massive weight loss patients, and talking about a Roux-en-Y versus a sleeve versus, all those different, a duodenal switch, we learned how to do those procedures as a general surgeon. So I know what the deficits are when it comes to their nutrition levels and things like that, and what part of the stomach was removed or what part was skipped and bypassed. So I think that helps us, for us, learning the nutrition and what we need to work up before we work on a massive weight loss patient as well. So general surgery has definitely played a huge role in our careers.
No, absolutely. I'm thankful for it. Even it's 5 years that was awfully long sometimes.
It was.
But yeah, I totally wouldn't trade it for the world.
No.
But getting back to your abdominoplasty techniques, how does not having drains impact a patient's recovery? What is typical recovery like for your patients?
So typical recovery, the biggest thing is compression garments. That helps with postoperative swelling to help take tension off of our incisions. Usually you're sitting at about 45 degrees after surgery. That's done by design. That's how a tummy tuck is done. We do that. We sit you up to take off as much skin as we possibly can. So you actually walk a little bit hunched over for a week or two. Eventually the skin will stretch. It always stretches no matter how tight we make it, and you will stand back upright. So I usually recommend, depending on the type of work that you do, up to 3 weeks off of work. And then really 6 weeks of no heavy lifting, nothing more than 10 pounds, and no core exercises, because we've worked on that muscle. And then with drains, when drains are in, we want the output to be of a certain value for 24, 48 hours before we take the drains out. With me, without doing drains, that's one less thing that we have to worry about. But, we always have to watch for seromas either way. When you take a drain out, you have to monitor for a seroma. And if I do drainless surgery, you have to monitor for a seroma. If that happens, that's something that you and I both take care of in the office. But we do have an ultrasound in the office to help with that. to help remove those seromas. So recovery, I would say for a tummy tuck is the longest recovery, just because mainly of the muscle work, and secondary, usually we accompany liposuction with a tummy tuck.
With abdominoplasty surgery, I kind of think about it like three parts of it that we're taking care of. We're taking care of the skin, we're taking care of the fat, we're taking care of the muscle. Of those three, which one of those three do you think gives most people the biggest result? If you had to pick one, if you could only get one.
If I only had to pick one, I mean, it's really patient based, but I would say a lot of women, not the majority, but a lot of women, and me, I'm in this boat now, have had C-sections in the apron belly where the shelf is, having that C-section where the scar is tethered. It really bothers them. So I would say the biggest thing for the majority of my patients is skin and taking off that overhang in the lower abdomen. Second, I would probably say muscle, the diastasis, the core weakness. A lot of people don't realize that they have it, and you can see it kind of when you turn to the side and bend forward and don't flex. You can kind of see it hanging down. That's what we tighten. But I would say that C-section, and it's me right now. I definitely have a diastasis. I can actually feel it, but I hate the C-section shelf, and that's what I'm trying to work on. But yeah, skin for me. For you?
It very, very similar to what you're saying. I think it's very patient dependent. I think for women who haven't had C-sections or haven't had any previous surgery, the muscle is actually the biggest problem, because you hear women, even women who have had C-sections, complain that they go to the gym and they work out and they work out and they work out and they can't get their stomach flat again because of that muscle laxity. And I think that's what makes it hurt so bad to fix. Mm-hmm. But I think it also is kind of restoring that core strength and that core shape is huge. So,
Yeah,
but
absolutely.
It is like you're right.
Yeah, there's plenty of women who don't have a ton of skin laxity. They bounced back really nice, didn't have a ton of stretch marks. And I like to call those a skinny tummy tuck, because they still need a tummy tuck because they need their muscles fixed, even if they don't have a ton of skin to remove.
Yeah.
The muscle absolutely has to be done. And I wish I could explain that to everyone over and over, even though you've lost the weight, you look thin, but the gym's just not going to do it. That fascia stretches and it just does not bounce back.
Yeah, and the thing that the conversation that I find to be the most difficult with those patients, the patients that don't have a lot of extra skin, but we're doing mostly muscle work, is that extra scar. Mm-hmm. Could you explain that for people?
I see you're holding your hands up and down, so you're talking about the vertical scar. So what happens when we do a tummy tuck is we keep your belly button where the stalk is, or the inner part of your belly button stays attached. We make an incision around it, and we pull the skin down and cut off the excess, make a new hole, because the upper abdominal skin gets pulled down, and bring that stalk back up through a new hole. Now, in someone who doesn't have a ton of lower skin excess, when we pull it down, that hole that we made is going to move down, but it may not come all the way out. So you may end up with a small vertical incision, which is the old umbilical site. So in my patients who I can try to predict that on, I always try to mention that beforehand, because you don't want it to be a surprise. They're like, oh, why do I have an extra incision? And usually we can kind of tell who is and who isn't going to have that extra scar.
Mm-hmm. Do you find they heal pretty well?
Yes and no. You think it would heal really well because it's very small, but you're turning a circle into a straight line. So they tend to have a little bit of dog ears, I see. And then it's also kind of the tough part of the abdomen is when we talk about, wound healing issues and skin healing issues, is between the belly button and the pubic area. That's the skin that's getting the least amount of blood supply. So sometimes I do think people have a little bit more wound healing issues with that incision.
I think that's one of the things with plastic surgery that is, it's important for patients to understand, is that all of the stuff that we're doing, we're really pushing skin to its absolute limits.
Yes, we absolutely are.
And are there tips and tricks that you have for your patients to kind of get them ready for surgery, so we can kind of push that limit a little bit more?
Absolutely. Obviously, it's always great if you work out and being in your healthiest form. Secondly, absolutely, and I can say this over until I'm blue in the face, and you've seen it on my social media a million times, no smoking, no nicotine, specifically nicotine. It causes, so that includes like nicotine products, so Nicorette, anything like people think vaping is safe, but if it still has nicotine in it, nicotine's the issue. I'll let your primary care doctor talk to you about all the other bad things. But for us, nicotine causes vasoconstriction. So vaso means vessel, constriction means to narrow. So you have these nice, big, healthy blood vessels that go down to about 1/8 the size. So you're not getting good blood flow to heal those incisions. So smokers, and even if you pick smoking up after surgery, I've seen patients in residency and fellowship training who have healed, their incisions have healed. They pick back up smoking, incision breaks down. And it's 100% the nicotine. So that's one big thing. And then optimizing nutrition, I would say, increasing your protein intake, and just mentally getting ready for surgery. But I would say smoking's the biggest thing.
So let's talk briefly. The subject no one wants to talk about with any plastic surgery is complications.
Yes.
So what we've talked, you've mentioned seromas. Talk a little bit about tummy tuck complications.
Yeah, absolutely. And I actually just did a whole, obviously on social media, it's short videos, but a short series on complications because I don't think people talk about it enough. And obviously, I always caution my patients when you're looking at befores and afters online. Every surgeon, myself included, is always we're gonna want to show our best work. So we're not gonna show those patients who have had issues. But with tummy tucks, any surgery that you have, there's always a risk of bleeding. Bleeding, I find, is less than 2% of the time in cosmetic surgery because, again, we're optimizing our patients. They're younger, they're healthier. We're not going to operate on somebody who it's unsafe to operate on. So bleeding, less than 2% of the time, but it does happen. Wound healing problems, wound infection, I usually mention it's higher in smokers and diabetics, but it technically can happen to anyone. So that's something that I always mention with my patients. You mentioned pushing skin to the limit. We can always have what we call the scary word necrosis, which is skin death, and the skin can die. Or when we're doing breast surgery, the nipple can die, nipple necrosis. The good thing about being a plastic surgeon is we are, especially when you're board certified, you've done the formal training, you know how to fix all those complications or at least help the patients get through them, do the wound healing, and we have options to correct what has happened. Other things with the tummy tuck, if you're doing liposuction, you can have contour irregularities or asymmetries. Incisions can have asymmetries. No matter how hard we try to keep the incision perfectly symmetric on both sides, nobody is symmetric. Every time somebody stands up, I'll point out and be like, did you know your right shoulder's a little bit higher than the other one? And people don't notice these things until we point them out. But you can always have asymmetry after surgery. You're going to have numbness to the abdominal wall that is going to take a long time to heal. Nerves only grow about 1 millimeter a day. And so sometimes that can actually be permanent between the belly button and the pubic area. That's the furthest place the nerve has to travel to, and sometimes it doesn't make it all the way back. And then the big scary complication that I always mention, because again, I think it's better to be informed than to be not informed, is with liposuction, there is a small chance that the cannula can go into the abdomen and into the chest, and it can injure an internal organ, which can require a hospital stay, and it can require a much bigger surgery. It's extremely rare that happens, but it can happen, and it can happen to the best of us. So I don't mean to scare my patients, but it's a big surgery, and I think that they should be informed on what they're making a decision on.
Oh, absolutely. Absolutely. And I think that brings up something that I think we need to sit down and do one of these just about liposuction, because that's one of the things that isn't talked about much, but is definitely happens. Mm-hmm. Well, you made it to the end of your first show. So we're here at the point where we're wrapping up. So tell everybody where they can learn more about you and our practice.
Yeah, absolutely. So obviously I am on social media. My Instagram's kind of my primary. I do also do TikTok, but everything that's on TikTok is on my Instagram. So my Instagram is dr.jessica_Walker. And then you can always obviously check us out on our website at trilliumplasticsurgery.com, or drjasonhall.com. And both of them will take you there.
All the links will be in the show notes.
Yeah, absolutely. And then on TikTok, I'm Dr. Jessica Walker. There's no underscore, but we like to have fun. I somewhat make the girls at the office do it with me. I don't force you to do it with me because he always says
You're
no.
You're not getting me dancing.
He always says no. But we like to have fun, but it's amazing that I did all this training just to make fun TikToks.
TikTok videos.
But the biggest thing is I try to educate. That's my primary goal. I do the fun videos to help fill the gaps to have something to post every day. But education's really what I like to do. So if you have any questions or anything you'd like me to talk about that I can do a short video on, just shoot me a message on Instagram, and I try to respond to people and do as many videos as I can when people ask questions.
Yeah, absolutely. And her content is fantastic. So thank you very much. We appreciate you making it this far. As always, if you got any questions, if you got any comments, if you've got any ideas for future shows, shoot me an email, info@drjasonhall.com. Shoot me a DM at Dr. Jason Hall. We'll put all the links in the show notes. Thanks again. We'll see you next time.